Here are 10 advantages of doing liposuction under local anesthesia. I'm Dr. Aniketh Venkataram, and here at the Venkat Center, we do liposuction very differently. Most places do this under general anesthetic, but we do it under local anesthetic. Why do we do this? Today, I will give you 10 reasons why we prefer to do liposuction under local anesthesia. Now, firstly, let us understand what is local anesthesia, what is general anesthesia. General anesthesia is where you are making the patient fully unconscious. Here, you're making the patient unconscious, you're taking over the patient's breathing. There is a tube in the patient's mouth, a machine is doing the breathing for the patient. The patient's muscles are completely paralyzed so that they don't move during the surgery. And anesthetic is given so that they don't feel anything during the surgery. Local anesthesia is where you're only giving anesthesia to that particular area where you're doing the surgery. You're not anesthetizing the patient as a whole. So let's say we're doing a surgery in the hand here, we give some local anesthetic here. Only that area becomes numb. The patient is awake during the surgery and they are fully conscious. This is the difference between local anesthesia and general anesthesia. Now, they both have their place. I'm not saying that general anesthesia should never be done. Definitely there are surgeries where general anesthesia is very much needed and which we do also. We do rhinoplasties under general anesthesia. We do facelifts under general anesthesia. But then why do we prefer to do liposuction under local anesthesia when everyone else does it under general? Let us go over 10 points. Number 1. Doing it under local anesthesia reduces the risk of general anesthesia related complications. While general anesthesia is good, when it is done for a long period of time, there are certain risks which are present. These include the risks of blood clots in your legs, risks of fluid in your lungs, risks of temperature control issues. These are risks that happen in liposuction because you're putting a lot of fluid in the body to do the liposuction. These are not present in other surgeries. Whereas when you do this under local anesthesia, we're avoiding these risks. The patient is awake and moving, so he keeps moving his leg, and that reduces the risk of blood clots in the legs. The patient body is alert and active and controlling the temperature itself. So there is no issues of temperature control. The patient can go to the toilet and pass urine. He can drink water. So there's no issues of fluid imbalance. This is what makes liposuction under local anesthesia very, very safe. The second big advantage is reduced risk of perforation. Now, this might sound scary. The worst thing that can happen during a liposuction is if you damage an internal organ. So let's say in liposuction, we're removing the fat that is below the skin. You have skin, you have fat, you have muscle, you have internal organs. So in liposuction, we're just removing the fat that is below the skin. The worst thing which can happen is instead of removing this fat, you go through the muscle and damage a deeper organ, like a liver or an intestine. This is very, very, very rare, thankfully. But the chance of it happening is a little bit higher in general anesthetic because the muscles are paralyzed. In local anesthesia, anesthesia is only given to the fat layer. The muscle below the fat is awake. So even if we touch that muscle, it contracts and it doesn't let the cannula go deep. So this is why the risk of this serious complication is avoided when you do it under local anesthesia. Number 3. There is less bleeding that happens when you do it under local anesthesia. The reason for that is the amount of fluid that we give is different. When you're doing it under general anesthesia, you're injecting less fluid before the surgery. In local anesthesia, you're injecting more fluid. You need this more fluid to give that anesthesia to that area. But one good effect of this is that it also closes all the blood vessels. There is hardly any bleeding during local anesthesia. Number 4 is that because you're awake, we can make you stand up in the middle of the surgery. See how it is looking, make you lie down, do some more. This gives us real-time feedback while we're doing the operation as to how the result is coming. And this helps us give a better result. Because things look one way when you're lying down, another way when you're standing up. It might look good on the table, but you won't realize something until the patient stands up 2 days later. That issue is avoided when you're doing under local anesthetic. Number 5 is we can change the position on the bed and do liposuction from different areas. So in general anesthesia, you're in one position, you're flat, and all the work has to be done like that. In local anesthesia, I can ask you to lift this side up a little bit. I can ask you to lift that side up a little bit. This helps me get better access to do liposuction in a better way and target the fat in a more uniform manner. Number 6, we are able to do a better dressing. After the surgery, we make you stand up and we put a wrapper around that operated area to give a proper compression dressing. This is a very important part of the procedure because we want to squeeze all the extra fluid out and we want to make the skin stick. Now, obviously, when the patient is unconscious under general anesthetic, there's only so much that you can do. But when you're standing up, we're able to give a proper 360-degree dressing, which helps squeeze all the fluid out. And this helps the skin to contract better. We get better skin contraction because of this. Another advantage of doing a dressing in this manner is we are able to squeeze all the fluid out properly, and this helps us to avoid the risk of a complication called seroma. Seroma is where there's a collection of fluid after the procedure, and this collection of fluid can cause issues and get infected later on. So this is why we are able to completely avoid this risk by doing the dressing when the patient is standing. Number 7, no drains. In many liposuction surgeries, they put something called drains, which are like tubes to allow the fluid to come out. Because of our ability to do the dressing in a standing position, we do not use any drains in our surgeries. There are no tubes hanging out after the surgery. Number 8, you can eat before and after the surgery. You don't need to be on an empty stomach for 6 hours before the surgery. For general anesthesia, this is very, very important. But in local anesthesia, it is not required. You can have breakfast and come for the surgery. Immediately after the surgery, you can have lunch. During the surgery, our patients can drink water, they can have some juice. The whole procedure is very, very comfortable. Number 9, better pain relief. In local anesthesia, because we're giving the local anesthetic into that area, that local anesthesia works for a good amount of time after the surgery is over. In general anesthesia, the medication is given during the surgery and given as injections after the surgery. There is no effect in the area that has been operated. This is why our patients are very, very comfortable after the surgery. They are all surprised. Everyone tells us, "Doctor, I was expecting pain, but I had a very comfortable night. I slept very well." So there is better pain control after surgery. Number 10, fast recovery. Under local anesthesia, you are back on your feet the same day. You can start working from home on a laptop the next day itself, and you can be back to work within 2 days. In general anesthetic, you're a little woozy after the surgery. It takes a while to get your senses back, and because of that, you might also take a little bit longer to get back to work. Your recovery is much, much faster under local anesthesia. So these were 10 reasons why we do liposuction under local anesthetic. This procedure was invented by Dr. Jeffrey Klein in the USA. It's called tumescent liposuction. This was studied by Dr. Jayashree Venkataram, and then I learned it from her. And we perform this procedure exclusively under local anesthetic. Now you might ask us, is it very painful, doctor, since I will be awake during the surgery? For the first 5 minutes when we're administering the anesthetic, you will feel like there's something kind of moving around. It'll feel a little strange. But after 5 minutes, you won't feel anything. In 90% of our patients, we do it purely under local anesthesia, nothing else required. In 10% of patients, if they're a little anxious, we give them a little bit of an anxiolytic to make them a little bit calmer during the surgery. And then once the anesthesia is given, they are as awake as everyone else. If this was a very painful procedure and we had patients screaming with pain, we wouldn't be doing it this way. You can see on all our testimonials of all our patients who have done this under local anesthesia, every one of them tells you how comfortable it is. So I hope this answers your questions about local anesthesia. If you're confused about whether to choose GA or whether to choose LA, both have their pros and cons. We have explained the reasons why we prefer it under local anesthetic. If you have any more doubts, do feel free to get in touch with us. I hope this video was useful for you. Do like, share, and subscribe to our channel. Thank you. Have a great day.